What's going on with your back?
I got a little bit too rambunctious in the gym this summer, and I ended up lifting weights a little bit too heavy, maybe than what my structure was able to do, and I have.
Tell me about how much was it? Tell me a little about it.
So 65 years old, and I'm squatting, free lift squatting, 250 pounds.
Okay.
And deadlifting, I got 280, almost pretty close to 300, and I was feeling really, wow, I can still do this. And then about a week later, after a lift, a session at the gym, leg session at the gym, I started having my lower back just really knotted up. And then I started having radiating numbness going down my right leg, mostly in my right foot. And so I thought, I overdid it. And so I backed off, and but it wasn't getting any better. I went and did some physical therapy. In fact, I went and did physical therapy before I got the MRI. And so some of the physical therapy I think that I was doing was making it worse.
And I'm going to turn around and show you why it was making it worse. You have what we call a grade 2 spondylolisthesis in L455S1. And usually for a thing to be this bad, part of the bone should be missing. We call it pars defect, which enables this bone fall forward that far, because otherwise they should be all aligned like they are here. So you're not imagining it. I see what the problem is. As a matter of fact, many times symptoms are even worse than what you just described.
So I finally went and got an MRI and the x-rays, and I could read the x-ray reports and read that I had a grade 2 L5 over S1 spondylolisthesis, and of course I had no clue what a spondylolisthesis was, so I went to Dr. Google, and then I sat on the internet for days and days and days, and that's kind of how I discovered you.
What do you do for a living?
So I am semi-retired from the oil and gas industry in Houston, and I'm now working part-time at the Bemidji, Minnesota airport in the parts department.
Okay, so you're engineer.
I'm a mechanical engineer.
So numbers and the literally mechanic makes sense to you.
Yes.
And you understand you have instability in your spine that move the bone in the wrong direction and practically pushing on your nerves. So we have a good understanding of what is going on.
Yes.
What did you find out what the options are to fix this?
I started Googling the types of spine surgery. I even went down the regenerative medicine path, and I had a Zoom meeting a couple weeks ago with the bioaccelerator Medellin, Colombia doctor.
In Colombia?
In Colombia, because they do advanced stem cell therapy down there.
They do more than we do here, yeah.
That was, that's when I started realizing I have a mechanical problem, not a soft tissue muscle.
Not a genetic makes sense.
So then I started understanding that there is a number of traditional back fusion surgeries, TLIF, OLLIF, ALIF. I learned that Tiger Woods had an ALIF, and he came back and won the Masters, a couple years later. And so I started feeling a little bit better about my possibilities. But then now
you need to mention as well that you do triathlon, that you're an athlete.
I'm an athlete.
Yeah, that is important to you, to get back to that.
Very important.
Okay.
There's a lot of mountains in the Andes in South America
that you want to climb.
I need to go back and climb.
And you promised me if I fix you, you'll take my...
I will take your flag, your inspired spine flag, to the top of South America, which is Aconcagua in western Argentina, which is about 23,500 feet altitude.
Well, I like to add to that a picture of me eating a big steak and putting it there too. You do the sport, I eat the steak.
Okay, that sounds great to me.
So it's important to you go back to be an athlete.
Yes, I'm not ready to sit on the sofa.
Yeah. What made you come to me?
The traditional back surgeries, the A-lifts, the T-lifts, the O-lifts, are not minimally invasive. There's a long recovery. So I quickly gravitated towards OLLIF type surgery. And when I did that, I watched a lot of your YouTube. You have a lot of great YouTube videos. Great YouTube videos.
I have thousands of just testimonials.
I feel
over
like
1,000.
I feel like I kind of know you when I walked in here because I've watched so many of your videos, and so I'm trying to educate myself.
Do you know why I put so many videos out there? It's so easy to put only your two best results out there. But if you put 1,000 testimonial out there, then it's not just your two best result, meaning you can deliver it again and again.
Right. So I quickly gravitated towards the I mean, who would not want to recover quicker?
Yeah.
And who would not want to lower the risk? I mean, to me, it's just common sense. And I'm very glad that you're here in Minnesota.
Thank you. Now, what did you find out about the other surgeries like T-lif or A-lif and so on? Why weren't they appealing to you, especially A-lif, like going from the front, what Tiger Woods got?
Well, so A-lif coming from the anterior, the front side, is it's the acronym I don't think describes or gives you a feel for the risks that are involved, because I think that there's a considerable incision in the front. You pull your organs to one side, and you have a cardio surgeon, a vascular surgeon has to participate, because there's two real critical blood vessels that are right in the middle of this surgery, and so it's a high risk, and it also sounds like it's a typical invasive surgery where you cut through a lot of muscle tissue, because you have to go in the back and install the hardware. So
I just was told 6 months ago that University of Minnesota, they shut down the anterior approach surgeries because of the outcomes, because of some complication. And I was told that about 6 months ago. I heard that 6 months ago, but I think this has been going on for a while, that they are shut down this kind of approach, going from the front and then from the back. Most of the surgeries are done as a T-lif. What did you find out about that?
I believe there's a lot of back muscles that have to be cut or removed or interfered with, and to me, again, coming from an engineering background, I need healthy back muscles to stay intact to continue my athletic activities.
In nature is, if you didn't need those muscles, they wouldn't be there.
It wouldn't be there.
That's how nature works. Now, the bad news, your insurance company, Health Partner, just informed us they don't want us to do this kind of surgery, the OLLIF minimal invasive. They want their member to get open old-fashioned surgery. We have done a lots of research, and we even showed them the result of our surgeries, yet they still want us not to help their patient with minimal invasive, even though we have 1,400 cases, over 3,000 levels, and we have 100,000 data point. Data, again, this is not a gut feeling, this is not a handful of patients. But they want on their member to have open old-fashioned surgery. What would you like to tell the health partners, whoever make that decision there, as somebody who is going to literally benefit or not benefit from this different, having the choice, at least having the choice?
Well, what just popped into my head was health partners would win in I think embracing OLLIF. They would win, I believe, financially and risk-wise.
By the way, we have a paper that shows that cheaper to them.
I would win.
Yep.
Patients would win, because we would benefit from the advanced technology and the truly minimally invasive aspect. And of course, you could continue and help teach their network about maybe open up their eyes and maybe embrace this as well. internally.
Well, you are the best salesman anybody could have. So contact them, let them know, talk to them.
That's my plan.
Very good. And I connect you to my team that we can just try to work harder to convince them. And it's good for their patient, it's cheaper to them. We have looked at that, we have published a paper. If all the open surgeries in the United States would be done minimal invasively, United States health economy would gain or save $3.4 billion.
That's incredible.
We published that paper.
That's incredible.
And still, I think we have to work harder to make those executive to see what they are missing and what they're asking. In their hospitals, in the cities, the average time of stay in the hospital is 6.2 days. Our average hospital stay in spine is 1.6 days.
I mean, when you start comparing the dollar impacts of what
Yeah.
you're saying, it should be kind of a no-brainer.
Yeah.
It sounds to me like there's a little bit of a paradigm shift that
Yeah.
maybe Health Partners management needs to
Yeah.
adopt.
And I'm sure you can help us to open their eyes.
I'm going to do the best I can.
Wonderful. Thank you so much for the interview.